Welcome to The Wellness Code. Nurse Melinda from Finish First Medical is here to share a variety of medical information and solutions to enhance your health and well-being. And now to guide you through The Wellness Code, Nurse Melinda.
Well, hello, Nurse Melinda.
Hello, Michael. How are you doing today?
Well, I am just doing most excellent. Thank you very much. It's delightful and lovely to see you once again. I understand that today we're going to be talking a little bit about regenerative medicine. Is that true?
Yes, I kind of wanted to talk today about what our clinic specifically does and our motto behind the clinic. Everybody is wondering, like, why do you have so many modalities, right? And so our thing is look good, feel good, perform good. Those are the three things that are our focus. And so I thought, well, maybe we should just talk about what regenerative medicine really means.
Yeah.
And I mean, to us, I guess you could say, because it could mean something else to somebody else. But what does it mean to us at our clinic, and how do we offer those services?
I think that I'm actually really excited about this and a couple of the things we've got coming up here. But the hormone replacement therapy, it looks like it affects everything for both men and women. Estrogen, progesterone, testosterone, and it can affect like moods and energy and libido and metabolism and what? You telling me it can affect my mood? Now, who are you to tell me what?
We call that a midlife crisis, right?
Yeah, it can be that kind of stuff. I've noticed that. I remember in the olden days, as my mom advanced chronologically, it appeared that she experienced some of these things, and some of the stuff we're going to talk about a little bit later on here. But I noticed a complete difference in moods and energy, and she'd be nice 1 hour, and the next hour was.
Yes, and so you just never knew.
No,
right?
I never knew. So I mean, that has to do with hormones, and now we can replace them.
Well, okay, so we don't want to replace them back. Well, some people do, but we don't want to replace them back to like what we were. We don't want to. I'm sorry, but I don't want my cycle back. But I want to protect my heart, my bones, my mind, my muscles. I want to protect my body, but I don't want, to be like all the other stuff that comes with it. But what science, in the Women's Health Initiative was a big deal, and they did this study and they stopped it because they said that hormone replacement therapy, specifically estrogen, causes breast cancer. And then it had this massive media attention on it, and when they had the media attention, then physicians stopped ordering hormone replacement therapy for women. Well, as the study continued, which a lot of people don't know, the study continued, they really realized that having that replacement just in the smallest amount can protect a woman from having cancer. It actually did the opposite of what the media said, unless you have an estrogen-loving cancer, and then you can feed it, and that goes into a whole nother story. And there's a book that talks about it. It's called Estrogen Matters. It is an amazing book, but there is this misconception that I think women are starting to wake up, because we are literally the last person or our last gender to really be taken seriously when it comes to our medical. And there's not very many people that are specialized in women's healthcare because women are so difficult. Our hormones do this all day long, where a men's goes up and then goes down and then goes up. Women's do this, right? And so when you talk about hormone replacement therapy, it is a little difficult, and it's a journey, and it's a journey that women should not have to go through. It is not natural for your body to stop producing hormones. We are causing our bodies to stop producing hormones because of our diet, and because of our lack of exercise, and because our lack of self-care, and because our lack of education, and it is can be detrimental to women.
So are you telling me that our diet can change our hormones and how they're, the level of hormones within our bodies, and what are some foods that can help boost our hormones for the better?
Right. So I always have my clients, it always seems to go hand in hand, hormone replacement therapy and weight loss. Those are the two things, because as we start decreasing in production of hormone, hormones, especially progesterone, is at the age of 35. And then you have from 35 to 55, then you stop and drop with your estrogen. And in the middle of there is testosterone for women. I always have them do a 1-ingredient diet, which is, if you look at the label and it says rice, that's what you eat is rice. If it's a potato, it's a potato. If it's carrot, it's a carrot. If it's, so it's a 1-ingredient diet. And then we look at your vitamin D and your B12, because those two are catalysts to all the other sex hormones. And if they're low, then we have to get those up to a therapeutic level at the same time as adjusting your other sex hormones so that you can function.
Yeah.
I know it sounds so weird, but if you're in the middle of the day and all of a sudden you get this hot flash, you literally feel like your body's on fire, or you can be freezing, or you can be irritable one minute and then happy the next. And, so many people are like, my wife's bipolar. No, your wife is just needing hormone replacement therapy and she doesn't know where to go.
Well, maybe she needs to call Nurse Melinda so I can get out there. I just think that's fascinating. Now, how does it affect men? Because I noticed that as I've gotten older and as I'm getting closer to 100, I've noticed that sometimes, and I don't know if it's my hormones or what's going on, but sometimes, like in the middle of the day, and I work out 3-4 days a week, I just kind of run out of gas, and I've got this attitude like, I just don't care.
Yeah.
Is that a hormone thing?
Probably. Yeah. And it's not that you don't care. Really.
Yeah.
We always just say, I'm just getting older. I'm just getting older. Well, I'm sorry, but I have seen some very healthy women and men in their 90s participating in the senior games here.
Yeah.
This isn't about getting older. This is about taking care of your body and giving your body what it needs. And yes, absolutely, testosterone is a major component with men and even with women. But with men, it's what gives you that edge. It gives you that a little bit of cockiness, assurance. Yeah. But it also helps protect your muscles. It helps protect your brain. It helps protect your bones. There's so many more benefits to testosterone, both for men and women. But the number one way to sell it is for sex drive. And so that's what you hear. So in your, situation, maybe you don't feel like you need extra testosterone because you are older and shouldn't have a sex drive or whatever. You know what I'm saying? But that's the marketing component of testosterone for men specifically. But what if I told you that just supplementing with a little bit of organic oiled testosterone could help you build a little bit better muscles so that you're not bending over or using a cane, or it supports your bladder and all those internal muscles that you have, so you're not having to wear a diaper when you are 70, 80 years old. Or you know what I'm saying? So it's more than sex drive, and that's what the world needs to know is hormone replacement therapy is more than sex drive. It is protecting your internal organs. It's protecting your heart, your lungs, your brain, your muscles, your bones. And guess what? You get a better sex drive.
Well, that's a positive bonus right there. So I need to ask you, can we, maybe in particular for men, I don't know how it works for women. I know you have more experience in that area than I do. But with exercise, does exercise help to build a testosterone level?
Yes, exercise does help build a testosterone level, but it's weightlifting. So it's resistance training.
Okay.
Can help. Yeah, absolutely. But, can it help that much? I don't know.
So it helps a little bit, but really what you need is like more of an internal treatment to complement what's going on externally. So it's like a full body workout, so to speak, internally and externally.
Yes.
Is that how that works?
Yep. Absolutely.
Well, there's some foods that anybody can eat that help to, maybe we're eating the wrong things that's killing our hormones, and maybe we need to eat different things, more like food is medicine. What are some things we should avoid, and what are some things that we should eat?
Well, you really need to avoid all processed foods. If it comes in a box, it's not food. Like, those little veggie straws. My daughter loves these veggie straws. I'm like, that is not real food. It's not. Give them a carrot. It's not real food. If it's processed, it's not real food. You're eating I mean, you wouldn't just walk over and pick something off the ground and eat it. Like,
No.
why are we eating not real food? That doesn't make sense to me.
No, we're lazy. And it comes in a box, and I'm hungry, and I have 5 minutes to eat, and off I go. That's
Yes,
kind
so
of it.
grab some carrots or grab some broccoli or grab, and I am not. You will see me at a restaurant, and I will probably be eating some French fries. I'm not saying I'm perfect. I'm just saying if you want the ultimate body function, then you've got to give the body the ultimate fuel it needs.
All right.
And then, yam is really good for women for their hormone replacement. But we're really seeing that we need actual help in that area. We need extra stuff. So at our clinic, we do an organic oil that we mix a compound with estrogen, progesterone, testosterone that works really, really well on the skin. It makes your skin feel so good. And you can rub it anywhere. And it just helps. It just is crazy. It works so good.
Does it have a specific name, or is it specific to you at your clinic?
No, I think that we've just been working with different pharmacies and, come up with solutions. I mean, if you don't want the oils and you want to go traditional, we can do traditional as well. But I like the oils better.
I think the oil sounds better. That sounds like a good thing to do. So with the hormone replacement therapy, or when you're doing these things, they don't just help you look better. You're going to help feel better, which I think help expand the cycle. You feel better, you look better, you look better, you feel better, and one thing just complements each other. Seems like a great thing to do.
Correct. Yep. And that's a lot of our hormone replacement therapy is based on symptoms.
Oh.
So yeah, that's a big thing. Is we ask what kind of symptoms are you having? That's the number one question.
So how does that work with stem cell therapy? Is that something you can do in conjunction with or instead of?
So our concept with the stem cell therapy comes as a complement, right? So we're getting you to feel better with your hormone replacement therapy, and we're offering an opportunity for a journey that's going to be a little bit easier, protect your muscles, protect your bones. But then we also want to be able for you to regenerate diseased processes or regenerate diseased joints and muscles so that you can move better, right? So we know that's part of that look, feel, perform. So part of that performance is stem cell therapy. And so whether we do mesenchymal cells or we do high-dose PRP, or we do bone marrow. We do all those options based on what your needs are.
See, I know we've done a few episodes on the stem cell therapy. I always find it fascinating. One of the things that I'm impressed with, and you can expand upon this, even though I know we've talked about it in a few other episodes, but I think it's fascinating that stem cells, they just kind of know what you need, and they go to the most critical part, what they deem the most critical part, and they work on that. So you may be thinking, oh, my knee hurts, I'm going to get stem cell therapy, and the stem cells, your left wrist really needs work, so we're going to go there first. I just think that's incredible how they know how to do that. So
yeah, because they're intelligent, right? All of our cells have a nucleus, and the nucleus is the brain of the cell. Like it's an intelligent thing. So I think that that's part of it, right? But when you combine the two, when you do mesenchymal cells, whether you do IV or IM or you do it in, the muscle that's needing repair, and then you pull high dose PRP, which is plasma-rich protein, then you put it in the joint, say because your knee hurts, then you're really just giving your whole body kind of a boost, but you're giving your knee that extra ability to heal. It's crazy cool.
It is way cool. I am so impressed with that. The other thing I wanted to ask you questions on is this stuff called peptides.
Yes.
What are peptides? I understand they do some incredible things.
Peptides are small chain amino acids that you produce in your body already. And I don't know if you know, but when you're working out and you're in the gym and you're here, get your amino acids. Your amino acids, right? These are components of your body that help repair and function better too. So peptides though have different things that we can help work with our bodies. We can boost our bodies with weight loss or brain fog or metabolic or gut health or skin health. We can do that all through offering different amino chains that are called peptides, and we give those to you IM or through the subcutaneous.
So I know that they can boost muscle growth. When I'm doing my workout and I talk to some of the guys in the gym, they're all talking about peptides and take this particular drink and do this. I see peptides all over the place. And so I see, is it true that they can help with muscle growth?
I don't know that I would necessarily say it helps muscle growth, but it helps function better.
Function.
Yep. And so when you're looking at like the reason why some of the peptides aren't FDA approved, it's because they are on that list of sports enhancements, because we're not necessarily making them grow more, but we're increasing your recovery time. We're bettering it. You're able to lift more heavier because now you're not sore the next day. So it's more of that component. It helps your muscles and your bones or your brain, whatever peptide we're working with. It helps your body function better.
I know you've got a bunch of them listed here. Some examples like BPC 157, GHKCU, and thymosin beta 4. These sound like robots from Star Wars.
Welcome to the medical world. We're like, one's copper.
What the heck is this? We're going to get C3PO and BPC 157 over here right now.
Right now.
So what do these things do?
So BPC 157 is like the mainstay. Everybody who wants to be a long-term athlete that wants to have a better performing muscle, then BPC 157 is your go-to. And honestly, I'm going to a peptide conference this weekend. It's a 3-day from 8 to 8 study on all different peptides and what they do and how they function. And so I'm so excited about it. But as we're learning more, some of them kind of do the same thing. So it's from you as an individual, what do you want? Where are your goals? And how are we going to provide the best product for your situation, right? And then the other one is copper. What is it? I can't even remember. It's like
CHKCU.
Yeah. So we use the copper peptides a lot with hair growth. When we microneedle our exosomes, we use them with copper peptides. And then also when we microneedle exosomes in the skin, we use the skin copper peptides, and they, holy crap, they are so good.
Really?
Like I have 3 different products from the company that I use. It's called ProXO, and I use the copper peptide skin on a lady that's never had any work done. So, she's 70. She's got quite deep wrinkles. She's from California, so she's in the sun a lot. Yeah. She has some sun damage. We did a 6-week post-treatment, just one treatment. And it was like the holy grail of all of it. It was amazing. I'm like, you walk in, and if you say, I don't like my wrinkles, I'm going to tell you we're doing copper peptides and skin exosomes. Because it's crazy cool how it works.
Do these things occur in nature, or do you can only get them as like a supplement or go somewhere? And I guess that was my main question.
Yeah.
Are these natural substances, or are they created?
Well, you can do like the drinks and stuff. You've got taurine. A few of the companies do amino acid drinks. There is one that our pharmacy uses that is really good. I can't remember what it's called. I have a picture of it. But you can supplement through the drinks.
Okay.
But a lot of the stuff that I use is compounded or injectable. So, yeah, you can get it different ways.
And that's available over at your clinic?
Yes.
We need to talk about that before we go today. And tell me about aesthetic medicine, because one of the things that I like that you got in here is that, sometimes in order to feel better, we need to look better. And if we look better, we've got more confidence. So it's like, okay, I'm going to go out and I'm going to make that sales call, or I have the confidence to go out and do this thing. Do you find that is a true fact?
Yes, yeah. It's crazy how our minds, we're taught to find the positive in every situation we're in. We're taught to love our bodies the way they are. We're taught to, find the diamond in the pile of shit. You know what I'm saying? That's how we're taught. And so we tend to don't want to shame somebody if they want to lose weight, or if they're heavy. How do you approach them? We don't want to shame them. We want them to love the way they look, the way they feel, whatever. But the idea is, if you look good, you automatically subconsciously feel good. And if you can use, mind, body, medicine, look, feel, perform, all of it is all in one encompassing thing.
Yeah.
So when I'm in the clinic, a lot of people will say, wait, you offer wrinkle relaxer like Botox and Dysport, that goes away from your holisticness.
Oh.
But the reality is, I tell you that if you could get rid of this chronic pissed off syndrome look, you're more approachable, people treat you better, you smile more. It is just more of an internal confidence builder for sure. But there are other products that we can use, like the exosomes, that will help with that. So you don't necessarily need to do the Botox or the Dysport or the synthetic stuff. And then there is also a filler called Sculptra that actually helps your body regenerate collagen naturally. So I think our aesthetic world is learning more and more about how to do it the more holistic or the more less chemical.
Yeah.
But, again, absolutely, if you look good, you feel good.
You said a term that really makes sense to me. And I don't think it's a medical term, but I like the pissed off syndrome.
I call it chronic pissed off syndrome.
People, you just look at them and they look like, they're just angry all the time because they've got this thing going on here.
Yeah.
And they're probably not angry, but that's the impression that they're giving because they have chronic pissed off syndrome.
Yeah. Yeah.
It's we need to get rid of that.
So another one is resting bitch face is what the aesthetic world calls it. But I used to, when I was younger, it's genetic. I think we just think so much. We're always in our head. And so you get these big 11s right here.
Yeah.
And you just look mad all the time. And whether it's concentrating or whether it's thinking or you're internalizing something, it makes it to where you look so mean.
Yeah.
Yeah. So I call it chronic pissed off syndrome.
Oh, I love that. That's a great thing. Well, before we go, we have a couple of minutes here. I know that with regenerative medicine, it's a lifestyle. It's not a quick fix. It's not like going and sticking a needle someplace that's got a problem and you go from sad to glad and you look like so I know it's a lifestyle and people need to make a commitment to do this. It's not a one-hit wonder. It's not a quick fix. Would you agree with that?
Yes, it's a journey. We all have, even in hormone replacement therapy, if you have stopped cycling and you think you're through menopause but you don't need this, you really do, so that you don't get dementia or Alzheimer's. But at the same time, it's a journey because our bodies change and evolve throughout life, right? And so it's not about preventing death. It's about living life.
Oh, I like that.
So we all are going to pass at some point, but let's pass happy. Let's pass it the best health we can.
Yeah. I'm going to try not to pass. I got a waiver. I'm just waiting for it to be signed. In the meantime, though, I'm going to start looking into more of the regenerative lifestyle. Well, Nurse Melinda, it has been a delightful time today. I've learned a lot about all these things: hormone replacement, stem cell therapy, peptides, and the benefits of aesthetic medicine. If someone has any questions, how can they get a hold of you?
Yeah, they can go to my website at www.finishfirstmedical.com, or you can call me at 435-500-6734.
Okay. And I know that You can also provide a free consultation initially if someone asks.
Yes. Yep. Our first consultation is always free because we want you to love and trust us, but we also need to make sure that we can help you in your journey, and we don't want you to feel like you're boxed in.
Yeah, that's good. Well, thank you very much for joining us. We'll see you guys again next time with another exciting episode of The Wellness Code with Nurse Melinda.
Thank you.
Take care.
You've been listening to The Wellness Code with Nurse Melinda from Finish First Medical in St. George. For more information, finishfirstmedical.com. Please like, subscribe, and share. And we'll see you next time on The Wellness Code with Nurse Melinda.